I am going to be demonstrating how to perform sterile dry dressing. The materials that you will need is your hand sanitizer, sterile gloves, some tape, your pen, and some sterile gauze. So I have verified my order and I have to change Mr. Smith's wound dressing. So I'm going to come in, knock on the door. Hi, Mr. Smith. My name is Janet, and I'm going to be your nurse. And I am going to be changing your dressing on your abdomen. You do hand hygiene, first thing you do. How are you feeling today? And you always want to ask the patient if they're in pain. Are you having any pain from 0 being no pain and 10 being very painful? Depending on what they say, if they are in pain, you might want to give analgesic, and if they're not, then you could just go ahead and proceed. So you want to put your just clean gloves on. So I'm going to first identify my patient. So you're going to ask for their name and their birth date, and once they verify it, you're good. Now you want to also get your bed up to a comfortable working height. Okay. So, quick note, you want to also wipe down and disinfect your table before you set any of your sterile materials on the table. So you just want to make sure you wipe, and when you wipe, you want to make sure that you wipe from bottom to top over and in this motion, because you don't, since it's sterile, you don't want to contaminate anything anymore. So you want to make sure that's the order you do it, and then after wipe around the edges, because your tape will be going on the edges. So you did that. You make sure that the patient is comfortable. Okay. And now that everything is sterile and clean, you want to get your tape ready. You will need 4 pieces of tape, 2 long ones and 2 short ones, and then an extra small one with your initials, time, and date. These are the shorter ones. And this last one will have, once again, your initials, the date, and the time. So now I want to go ahead and expose the patient, so you want to let them know. So I'm going to be taking off the cover and putting your gown up a little bit, okay? They should have an old dressing, so you want to take this off. So you want to peel from the outer edges and put them inward towards the center. And do this kind of smooth, because removing the tape can be painful to some patients. Okay, now as you take this off, you are going to assess the dressing, the old dressing, for what we call COCA, which is color, odor, consistency, and the amount of the drainage, if there's any. So as you turn this over, you look at this, there's nothing. There's no odor coming from it. No, since there is anything, there's no consistency and there's no amount. So what you want to do is take it in your hand, take one glove off, put it in your hand, and remove your old gloves. Throw it away. You want to perform hand hygiene again. So now you want to open up your sterile gloves. So before you open the package, you want to assess the package, make sure that there's no breaks or anything in them. And you want to make sure that the table is above your waist. Okay. And I can actually go ahead and open one of my gauze, because you do have that 1-inch border, so you are gonna take it and just have it ready. So just the outer edge. What you can do is go ahead and open this. Just make sure that doesn't move. Okay, so that's ready. So now you want to open your gloves. And same thing, you have that 1-inch border, so you're fine. And make sure you just kind of fold these out a little bit, because they will tend to fold back and then you'll have a lot of trouble with these. So you have the outer edge. Okay. You open it. You want to put your dominant glove on first. So what you're going to do is go ahead and get your left hand, go over, pinch, and then lift it up and back. Go back and then go ahead and put your arm in, your hand in, I mean. That's all you do. Don't touch it. If if 2 fingers go into one, just fix it later. You don't want to do anything right now. So now with these 4 fingers and your be careful with your thumb. You want to go ahead and grab under the cuff without the thumb touching anything, and you could touch the outer border. Okay, pick it up. Go back. And now that you have both gloves on, maintaining sterility, you can fix your gloves now because it's sterile to sterile. Okay? So now this is sterile, so you can touch only your sterile stuff with sterile. So now that you got this, I can go ahead and take my sterile gauze. Okay? You wanna, okay, there's 2. You wanna open this. You wanna, obviously you see how big the incision is, so you kind of know how big you need your gauze to be. So this is about right. So sterile to sterile, you go ahead and you place it over, covering the incision. So now that it's covered, it's no longer, you don't need to technically be sterile anymore, because the sterile part is already touching what needs to be sterile. So now you can go ahead and take your pieces of tape, put it on the side, then your 2 short ones. And then the last piece of tape can go anywhere, because it just has your initials on it and the date and the time that you changed it. Okay, Mr. Smith, we are all done. So you want to make sure that you cover your patient back up. Make them feel comfortable. Make sure that they're light is within reach. You want to put the bed back down. Okay, and always promote comfort and safety. And is there anything else that we can do for you today? And if they say no, well, you can go ahead, throw away all your supplies, all your trash goes away, and you throw it away and you clean up, take off your gloves, perform hand hygiene again, and then you go and document right as soon as you finish.